Hello, everybody. We're going to get started with our webinar, How Baptist Health Turned Invoice Exceptions into $2.9 million in savings. So my name is Matt File. I'm the EVP of Marketing here at Penrod. And joining me today is Matt Arsenault, the Executive Vice President and Chief Financial Officer at Baptist Health South Florida. So great to see you, Matt.
Great to be here.
Great. Before we begin, just a little bit about Penrod. We're a boutique Salesforce consultant focused on helping healthcare providers improve pretty much every aspect of their business across clinical departments, administrative, and now supply chain. Lately, what we've been doing is uncovering just a ton of opportunities for cost savings in the supply chain, and that's what we're here to do today. So just going over today's agenda, speaking of the supply chain, the goal of this is talking about how Baptist Health South Florida turned invoice match exceptions into 2.9 million in savings. So to do that, we're going to take you on a journey, starting with breaking down the problems and the challenges that healthcare providers are facing with their supply chains right now. We're hoping some of these challenges will resonate with you as we talk about them. Then we're also going to go into the gap that exists between ERPs in that procurement and payment lifecycle, talking about the hidden financial costs that you may not be aware of and how to solve exceptions 6 times faster, how to repurpose staff time to focus on exceptions in a more efficient way, quantifying the revenue leakage that you might be facing, and then really quantifying what the value is of fixing all of those problems. Just going into some background of what healthcare providers are facing right now. When we talk about problems in the healthcare supply chain, a lot of that is going to come down to cost. So based on our own internal research here with our clients, with our prospects, and then just general market research that we do, a lot of providers are saying that their top priority is cost reduction and revenue growth. And that's really not a surprise, especially since a lot of that is going to come from the supply chain. One provider said that they were actually looking at approximately like a 7 to 8% cost reduction in their supply chain management operating budget. And those savings can really come from a variety of places, depending on where you look in your business. It could be something like overall SKU reduction, clinical standardization, vendor consolidation, different consignment models for holding inventory, and then also dreaded headcount reductions that we can talk about. But really, when you look at some of the headwinds that are identified by Becker's Healthcare, they've identified number one issue is that there are staffing shortages at providers. And I think simply making impulsive decisions in the supply chain, especially related to headcount, that can really cause increased costs. But because those financial pressures still remain, what we really like to focus on is how technical integration, which is going to deal with your ERP and what other systems you're using. It's the fourth headwind here, really looking at that technical integration and your supply chain, how that can make a really huge impact on cutting costs. And that's where we're going to get into the $2.9 million savings that Baptist Health South Florida found in their supply chain. So this might look familiar to all of you. It's really just a typical procure to pay journey in the supply chain. And you can see it's really messy. When we look at this journey from the initial request all the way to the final payment, it's really a series of many actions with many people. And you can see these little flashing links that are broken that indicate that there's a lot of potential margin leaks. Matt, I really wanted to bring you in with your perspective to walk us through why this journey is so prone to hidden costs and just black holes where you don't know how to report, you don't know how to look at what those costs are.
Great. Thanks, Matt. Yeah, happy to do that. When you look at this path, you realize that the actions that we take at each stage are very different. The clinical value analysis at the start is a completely different animal than the contract sourcing or resolving an AP discrepancy at the end. In an organization like Baptist Health, we're managing thousands of these transactions, thousands of items, thousands of suppliers all at the same time. So the blue circles, that's where the ERP lives. And it's a vital system, right? Nobody's arguing that, right? They keep track of the data, the financial transactions, but it's really between the circles, right? That's where the communication happens. Or more often we found where it fails. The ERP system does not manage that stop and go workflow. They can tell you something's wrong, but they can't automate or have that really bi-directional conversation to fix it. So that's where the tools that we are looking at really manages that. The complexity tax is something that we talk about as well in healthcare, right? You deal with contract versus non-contract pricing, shipments arrive after the bill, item substitutions, right? If you try to manage all these things manually, you're using a manual drill for a job that requires like an electric drill. So you lose visibility, and suddenly you've got clinical leaders saying, "Hey, nobody even told me there was a problem." So just the complexity of healthcare unto itself is also a dynamic of this.
Yeah, that totally makes sense. And I just wanted to bring up, like, if you have any questions throughout the presentation, there is a Q&A button. So feel free to ask your questions there. If Matt talks about something that really resonates with you, if I mention something that you want to ask more about, and we'll tackle those at the end of the presentation. So we've gone through that procure to pay journey. With your experience, what are the main issues in the healthcare supply chain that are really costing hospital systems?
The one that probably CFOs and others can commiserate with is the idea of credit holds. Usually that's when a problem really flares up on the clinical side, but that's just one of many issues. Hospital systems, our view is you got to have a broader view of the supply chain in order to drive improvements across the board. Without that view, it's broken, low data visibility, broken processes, often reactive and just putting out fires. But in the case of Baptist Health, our payment management process was disjointed. It lacked visibility, so it was difficult to identify, all right, what was the root cause when there was a match exception? But typically, you spend all this time working on it, and then the data's stale by the time you've figured it out. So that key is that visibility into the supply chain, right? That lack of visibility is the main issue. So in order to have that visibility, it fosters compliance and then accountability on who's going to fix what step of it, right? That's like the health chain tool. It's that gives us that system of truth regarding the communication piece of it that's taken to resolve these exceptions. So now it allows us to short pay a vendor after they've approved that action and we have visibility to it, right? I've been at Baptist for 20 years and have been experienced the whole finger pointing that happens through the procure to pay cycle when something's not operating smoothly. It's very easy to get bogged down in that when there's so many process parties involved. Everybody blames everybody else, but like we need to bring transparency to that. That's what solves it. It shows, hey, where is the issue residing? When does it occur? And then even better is how do you automate the communication to directly get it to the right person to fix it? So usually it's broken because there's that break between the AP and supply chain staff, which to add a level of complexity usually sits in different parts of the business as well.
Yeah, that really makes sense. It's a good point. I've heard you talk about the ERP gap a lot. Most hospital systems, they're spending millions on Workday or Oracle or GHX for identifying exceptions. So they think of those systems as the real center of their operations. Why aren't those tools with that huge investment enough to manage these exceptions?
Those tools are great. They're really good at your books and records, right? And they tell you what happened, even where there's an issue, but they're really bad at handling work in progress. So when an exception happens, you have a match exception, where does it go? Where does the work go? For most organizations, and with us before implementing this, it was either an Outlook or Excel or some combination of both. And that's really the missing piece because there's no visibility of that. There's no audit trail. There's no accountability. And that's how you get leakage in the system. There's got to be that bridge between the ERP and the work in process that can handle that two-way communication and interactions that an ERP just really isn't designed to do. It's good at the what, and the communication piece is really the how. So we need to connect the what and the how. And a lot of folks have tried to use Outlook for that, but Outlook doesn't have that sort of central visibility. We can see what's happening with each individual's Outlook application and what they're doing and that data feed to the ERP to resolve it. There's a lot of BI tools out there, especially supply chain focus and other vendors who are doing a good job of, again, identifying the problem, escalating the problem, but they don't have that communication tool and the automated communication tool to resolve it. So it's just like you need a hammer to hang a picture, not a sledgehammer. Every match exception is different and you can't solve each one the same way. So that ERP, again, is that foundation of the what, but that precision tool, close the gap and identify quickly like what needs to happen to resolve it, and then actually facilitate doing it in many cases in automated fashion.
Yeah, there's a lot that can happen between the what and how, for sure.
Mhm.
So that's the important part. So, that gap between the what and how, we view that as the gap between the ERP and the work in progress. So what are the main costs that CFOs like yourself, and let's just say supply chain leaders too, the costs that they should be concerned with? What are those?
Yeah. The first is early payment discounts, right? You don't you typically have control over when and how, well, sometimes how, but when you get invoiced, right? It's that ability to you do a great job negotiating in a contract all these early payment discounts. You want to be able to get those. So we noticed in studying the average time for a match exception is like over 60 days, and we've cut that down to around 10, right? So we're able to really capture so many more of those early payment discounts. The other is, again, this is much more common in healthcare, is that idea of when contracts aren't clear and exceptions pop up, vendors often charge less price, right? Which we've seen can be upwards of 170% higher than what you negotiated. That's a common situation. The other is that credit holds that I talked about and that clinical risk. Like the last thing you want is when it's gotten held up, that you can't get a supply to a clinician. That's really can create all kinds of problems. And then the idea of let's say you did pay or overpay. How do you recover that? How do you have the data to track those errors? And what happens is a lot of systems you just overwrite in the ERP that discrepancy just to get the payment processed, right? That's where we uncovered 2.9 million in that recoverable overpayment in a single year because we captured that data as soon as the exception happened. We didn't have the issue now of overwriting things with that. And then to talk about the labor side, which I know we'll talk about more in a minute, right? That idea of staff fatigue, right? It's a slog to really manage and try to be successful at match exceptions because it's just a lot of manual process, very small, sometimes small issues.
Yeah, I think further when you talk about labor costs, what else would you say are key ones?
The biggest is as soon as there's a problem, conversations immediately in most organizations move to email, right? And once it moves to email, nobody knows who's responsible, how long it's been open, what's the status. Somebody coined it like this illusion of communication. Oh, we're communicating, but you're not really, because everybody else just assumes somebody else is on it. Employees don't need a follow-up list when they implement what we saw when we did health change. Follow-up lists are manual, they're time consuming, and there might be a vendor on the other side with an email in their inbox that they also need to follow up and investigate. We have this sort of auto escalation, which really helps with that. We have about 90,000 emails a year on supply chain issues is what we kind of estimated it was. And that each email means an employee is spending time typing, looking for information, chasing down a clinician, right? So without automation, every exception requires a person manually look up something in the ERP, look up the invoice number, look up the PO details, right? When you don't have it spoon-fed or automated, even a simple $500 variance can take hours of work to reconcile. So again, employees get frustrated. They're forced to do mundane transactional work instead of higher level stuff like helping work back order issues or other things. And then the worst case is whenever there's a problem that finds its way into a clinician's hands where a clinician has to do extra work or somebody on the floors, we don't want that either. That's unnecessary noise that strains that relationship with them and their patients and also us as a supporting organization to the clinicians.
Yeah, absolutely. I also think about reputational costs of this. Do you have any insight into reputational costs that people should be concerned with the supply chain?
Yeah, you want your supply chain to be known for the great work that they do, right? The finger pointing is right here. That's so common where who screwed this up? And usually AP gets the blame most of the time because they're the last one to touch it. But it might be that how come nobody paid? They just got it, right? When a hospital, can't explain why an invoice hasn't been paid, somebody in the clinical area is complaining, the vendor might be complaining, and right, loses trust with them. But without that trust, vendors are less likely to offer good deals. We try to have a really good partnership with our vendors. Also, they'll be less willing to put credit holds if they're you're real transparent and they know what's going on. When vendors start complaining as well, they don't know that they could be the problem. And without that data, hospital leaders, they got to stop. They got to deal with these emergencies and threats when it could be actually the vendor's problem. The vendor's complaining, they don't even know it. And then the other thing is that idea of mistakes and vendors defaulting to list prices. Again, our calculation, what we saw, it's about 170% higher than contract rates. And if the hospital doesn't catch that right away, you might wind up paying more and then not even being able to really know that information very clearly.
Yeah, it totally makes sense. But in the case of Baptist Health, if there's $2.9 million there just for the taking, and if labor is this tight, why isn't every health system in the country fixing this today or tomorrow? What is the actual barrier to fixing it?
Yeah, I'm sure every organization like ours has your improvement prioritization list, technology prioritization list. A lot will be like, this is granular, it's a back office issue. But that's a trap and not really a good way to think about it. It's actually a big labor drain, right? If you don't have visibility, you don't realize you're paying an army of people to do this email slog. They're just chasing their tails in Outlook, and you don't see a fire until it becomes credit hold. And a surgeon's call you because they don't have a stent for a case at 7 a.m. or whatever. So, that's a big issue is lifting the hood a little bit as to actually what's going on in this work and why there's a real opportunity. The other is people assume that the ERP can fix it. They think, hey, I bought this, we spent all this money on this Ferrari ERP, like Workday or Oracle, you name it. And we do these pitches on why we need to spend this money. And now you just ask for another tool, right? But again, the ERPs are great for the books and records, but not for that wet, right? They won't help you fix it. Really, our George Godfrey, our chief supply chain here about this, he always says like ERPs don't manage communication. And if your resolution happens in a black hole email, then your ERP is just not, it's not actually solving the problem. The other is people don't realize the leakage, right? They think, hey, we don't have a lot of exceptions. And our answer is probably, how do you know? If you just overwrite price data to get the invoice paid, which some organizations do, then your leakage is invisible. So if you can't see that variance, as soon as you get that match exception and you have a process and a tool to be able to track that, then you're just guessing at what your ROI is, but you have that transparency. The other thing is just change fatigue, right? How do you get this on your list of process? We just went live on this other new system. We need to stabilize it. But again, if you want 2 years to fix that communication gap, then you're losing $6 million in overcharges while you try to do that. You need a technology solution because again, Outlook and Excel are what you're going to wind up managing it, and you're going to leak cash. You got to manage through the ownership, right? Should this sit in AP? Should it sit in supply chain? Who owns the exception? Is it the clinical department? And a lot of hospitals, hot potato, but somebody needs to step up and say, I'm gonna own this solution. Our chief supply chain, I sat down and agreed. I said, you know what, this is not a supply chain problem or finance, it's a system problem. This is people, process, technology. And we got everybody on board of this kind of system of truth so that there's no more finger pointing. Once people saw it, they're like, oh, okay, great. Yeah, that makes a lot of sense. And then just the adoption, right? Some people like working in Excel. Some people like working in Outlook. You're asking them to do a new tool, but that's it wasn't really an issue just because we expressed the opportunities and saw that and people working it, and that transparency really helped.
Yeah, absolutely. So when we talk about the tactics that you actually put in to bridge the gap, how did you do that?
What we did is really put in health chain as that bridge between the ERP and the workforce and going all in on implementing the tool. It's just because the CRM based tool it's an engine built on Salesforce. It's just great at communication. CRMs are great at communication. So it houses all the communications, libraries, and managed documents, and that searchable history of every exception and what went into trying to solve it, right? Also that it takes complex ERP data and it spoon feeds to the exact person who's responsible for fixing it, right? So this is automated email. So it's, hey, you're going to get an automated email. Here's the issue. Here's a specific contract, the invoice number, and what you need to do to fix it, right? So that whoever winds up being the person that was identified as to fix it, doesn't have to do all this extra work. Here, hey, this is the problem. Do this to fix it. All automated. The other is that because you're identifying it and creating a case in the system for every exception, you know exactly what the issue was and you can quantify it. So that's that 2.9 million gap that we did. And what I think is even one of the best things is that once the solution is identified and the person or system responsible, even the vendor, takes action, it automatically fixes it in the system, right? It feeds it back into the ERP and it's corrected and it's closed automatically, right? So nobody has to go through and check, was this solved? Was this solved? Was it solved? Once it's resolved, it's automated and the ERP sees it as automated and it moves through whatever other part of the process. So all that communication with vendors is now conducted through the health chain tool, right? So that includes match exceptions, contract negotiations, item substitutions. So now we have this complete picture of these communications that has the bidirectional with the ERP.
Yeah. So we've gone through the missing piece, and what I'd like to do is dive more into a little bit more detail about what's going on inside of it so that
Mhm. Yep.
so this slide demonstrates the winning process that you've implemented at Baptist Health between the ERP and work in progress. So can you just walk through how this cycle actually can create millions in savings?
Yeah, absolutely. First is this sort of continuous engagement, right? It starts in the ERP but doesn't end there. Like traditional transactions that require attention, usually there's an issue and it sits in a queue. And then a person has to go in and find them in an ERP or in an inbox and then start working it. In this process, transactions don't wait for an employee, right? The moment's identified, the data gets pulled in and the system starts working immediately. And it does it by classifying, okay, what type of problem is this? And it's that automated logic. It diagnoses what's the cause of this failure. It uses the ERP data to identify that, classifies it. Is it a price difference, receiving error? Is it a duplicate invoice, right? Somebody invoiced us twice. So that when your team finally touches it, they're not investigating, they're resolving, right? And then the key is this consistent resolution, right? It's that automated call to action. So we spoon feed the necessary information to the person responsible for the fix. So if a vendor or a department doesn't respond, the system doesn't forget that. It knows, hey, I haven't gotten this resolved yet. So it automatically escalates the issue after a set period. And we set that based on the type, right? So what we want to do is hit those 10-day resolution times and not miss out on anything. So if you send it to somebody and then not resolved, for as example, in a department might escalate to their boss or somebody else saying, hey, we have this unresolved thing, you need to fix it. But you don't have to investigate. Here's what you need to do. We pulled all the information for you to make it easy for you to resolve it. So then that loop closes, the action, it's verified within the ERP, right? So it doesn't disappear, but every communication, every timestamp, that audit trail is in that central system of truth, right? So that's that compliance, right? We've all had experiences of fluffy savings numbers and things like that. You don't have that issue here. It's like you can look at audit that detail of what we're saying we identified of the resolution. The best part though, I think, is that the staff now they're not firefighting, right? And they're much more strategic. It manages these mundane follow-up things are automated. So now they're higher level, they're focusing on vendor negotiation, long-term contract optimization, other issues, rather than just that slog. It's really been a great success for us.
Yeah, and I think when you can actually dive into a little bit of what this looks like from a dashboard perspective, so you can just see that you really get an overall view health of your match exceptions just at a quick glance. What you're seeing here is just like a small sample of the dozens of views that you can get in Health Chain. They're all designed to help you quickly understand where the exceptions are occurring, who owns them, and then what actions are being taken. So really filling the gap between the what and the how. So then you really have the ability to drill into the details. So you can even see here the count of match exceptions by supplier. So you can really see which suppliers are having the most problem with match exceptions. You can view this by count or by dollar value. So you can really focus on that vendor, take a look at maybe what tactics you need to do to bring them back into just a better value on the overall match exceptions. You can prioritize the conversations you have with the suppliers. You can have really data-driven discussions around, hey, what's the pricing accuracy? What's your invoicing behavior? And then identify really the process gaps that are happening that are making this number jump up higher than any other vendors. Another one is the open match exceptions by subclass. So you can break into the open exceptions that you have and then take them down to a subclass categorization. And you can look at this too by volume or by dollar value. And this really matters because it's going to identify what the biggest contributors are to your overall exceptions. It's going to show what teams or functions are carrying the largest burden of exceptions. And then it really just helps pinpoint the root causes and maybe the process breakdowns, not just the symptoms. It's going to give you an actionable way to go and solve these things. And you can also see open match exceptions by owner. Here we're looking at the match exceptions you have. It could be a team, could be an individual. And this really matters because it's going to provide visibility into what your workload distribution is. It's going to highlight the capacity imbalances across your teams, which teams are working harder, which ones aren't working harder. And it's also going to surface individual performance. You can see who's really doing a good job at resolving exceptions and maybe who needs more coaching or different tactics to approach. One of the ones I really love too is the open match exceptions by status. So it's going to show like where each exception is in that life cycle, and then also what actions are being taken on it. You could see exceptions that haven't been addressed yet, but they're assigned to a user. It's going to indicate the outbound emails that have been routed for resolution. It's going to tell you if a response has been logged and if an action has been taken or if it's underway. And it's also going to indicate that a user addressed the match exception in the ERP. And the nice thing about that is it means the case will close automatically. So it's going to give you real-time visibility into bottlenecks, velocity of solving these exceptions. It's going to ensure that like exceptions are not stalled or forgotten about. And it's really going to reinforce that this whole process is being governed throughout the whole thing. Once an exception is logged, it's closed, it's removed from the open exception dashboard. That's going to give you a real clean view only of what still requires attention. So it's really going to help you focus instead of getting just lost in this sea of match exceptions. It's going to help you focus on the right ones. So that's just an interesting view into how that dashboard can help. But Matt, like implementing this solution, bridging that gap between the ERP and the work in progress, what value has Baptist Health gotten from that?
Yeah, the savings are both like direct savings and indirect savings, right? We really hit our stride. Our processes really were faster, automated, we're a lot more user friendly, right? Each year we're seeing more money saved and fewer fires that we have to put out, right? Because the system's automated, right? We need fewer people to manage the higher volume work. So our employees are able to move away from clerical tasks and be more strategic. And it's also significantly reduce waste, for example. Like we no longer deal with kind of these ghost shipments of canceled POs being delivered when they're no longer needed. But beyond kind of the immediate savings, right? I think the biggest transformation is this transparency visibility, because you've got the system of truth across the supply chain. Driving improvements it's just so much easier because of the opportunity. And it's also changed the power dynamic with vendors, which I think is really, we can't kind of stress enough how strong that is, right? So we had a vendor that was getting very noisy about payment issues. They were really giving us a hard time over dispute, kind of big vendor with lots of tentacles and parts of the business. In the past, that would have been just this big exercise and finger pointing. But now we're able to show the complete audit trail. And we showed them that the issue is we were escalating the email to one person on their team that just wasn't responding. We had every email, every timestamp, all the backup. We weren't guessing, and we were 100% confident we were right. So having that was immensely powerful in resolving that situation and putting the vendor on notice that they needed to clean up their act and what they were doing. And then the other is just the team, right? Before we kind of bridge that ERP gap, like our staff, it's just a frustrating exercise. You're chasing emails, you're managing manual processes, and now job satisfaction we see is much higher, right? They're doing much more meaningful work. We're leveraging technology to do the heavy lifting so people can focus on that long-term value, capture the payment discounts, ensure contract compliance, all these other tasks that are much more higher level.
Yeah. So also this automated resolution process is really working to solve the labor dilemma that we talked about earlier. We both know it can be really hard to find good people, but it's even harder to keep them if they're spending hours a day fighting with spreadsheets and sending emails. How do you, as a leader, repurpose your staff's time so that they can stop doing all this kind of clerical work and start doing the more strategic work that a system of your size, I'd say, really requires?
Yeah, right. They're clearly on this, right? If you see it, it's like there's productivity gains, so we can be scalable. We're a growing organization. So it's this idea, how do you scale, do more with less? Like the others rule like that accountability is a big piece of it too. There's a lot more visibility on the quality of work. If you have somebody that's not necessarily doing a great job, it's much more clear now. You can see they'll stand out. But it's getting folks out of that email slog. That was a real retention killer. People usually having a lot of work is not as much of an issue as quitting because the work they're doing is just frustrating and not very fulfilling. So by automating those mundane outreach and manual tracking, we cleared the clutter. So They want them to be kind of professionals. We want to elevate them, that managing relationships, not those kind of clerical role functions that they're doing. So a lot of it's this shift, right? To exception management, like we moved our team to a model of sort of management by exception, right? In the old way, a buyer might spend sort of 70% of their day just verifying that things went right. Now technology handles everything that goes out, lights out, and our staff only steps in when their system flags something that was an issue. This means their time's not 100% focused. The problem solving, that's where the value is. Also, the more you give a team member a system of truth with a full audit trail, that changes how they interact with vendors, right? Instead of spending 3 days researching a $500 discrepancy, they have the answer in seconds. They can now go into a quarterly business review and say, hey, here's where you missed the mark on 400 invoices last month. That's a strategic conversation that drives savings rather than, hey, what's up with this one invoice and a tactical argument over one piece of it. Really changes that dynamic. Clinicians, right? This reduces, right, the spoon feeding of the clinical leaders, the exact data they need when we do need them, right? Makes that a lot easier. So that administrative tax taken away from what they need to be doing, which is clinical care, is big. And that's the highest value work in the organization. So we're reducing that is big. And then really just that, like allowing people to be more productive, right? So when you repurpose this time, you can use it to spend more time on training. In a manual environment, it kind of takes months for a new hire to learn how things work in an organization. But with this, people can get up to speed much, much quicker. So that is that defined digital workflow, new employees productive in a fraction of the time. So we've purpose management to training, moving from training to more of this mentoring strategy and getting people at the top of their game, top of their license.
Yeah, absolutely. We talked about the $2.9 million recovery. For the CFOs and the supply chain VPs, leaders listening today who want to find their own hidden savings, but don't know where to start, where can they start doing that? How do they actually quantify the leakage that is currently somewhat invisible to them at most systems?
Yeah, first would be trying to capture that day one variance, right? You can't rely on necessarily the ERP audit looking back. They're designed to clear it. To quantify leakage, you got to capture that variance day one. I think as soon as that exception is created. The other is what are your buckets? Why do you have that exception? And try to identify those. Is it pricing? Is it receiving? Is it PO status? Like we were surprised to find that receiving was one of our largest leakage points, errors in receiving and or discrepancies. I shouldn't say necessarily errors. With that, really list price defaults is a big part, right? That you're looking at vendor behavior. Again, when there's contract ambiguity, vendors can default to list price. Again, we said we thought about 170% higher with that. So if you don't have a process to look at that, and then, right, the leakage isn't just about overpayment, it's cost of slow work. So it's the last activity on a case is something that we measure. So if you have a dispute of a match exception, it's been sitting for more than 30 days without anybody communicating on it, which you might not know, but right, that's a high risk for it being a leakage, whether it be just an error or a credit hold or a payment discount that you're missing out on, right? So that 50-day gap, we're doing 10 now for usually 60, is that financial leakage. So when you have all that, it gives you that stronger stance to negotiate better terms and make sure you're compliant when you do have it.
Yeah, that's great. So in that winning process, we've already talked about the cost savings. As a CFO, what are the key measurables that you expect when bridging this gap?
Yeah, our key KPIs, we look at average time to resolve a match exception by supplier, right? We see who's moving fast and who's dragging their feet with that. Then internally, right? We have departments maybe that need to do something to resolve it. So it allows very good accountability. Again, if we're overcharged with the value of that overcharge, that how communication per exception, like how many touch points did it take to resolve that, whether it be a manual or automated? And then escalation. This is really usually a subset of the first two in that, hey, did I have to go up 3 levels before I get somebody to resolve it? And that could push back at either an issue internally in your organization of somebody not doing their job or with a vendor saying, hey, are you directing us to resolve this with the right person? Or is there somebody else that we should be reaching out to in the vendor's organization to resolve it? So we can address those friction points before they turn into a problem.
Yeah, great. Matt, so we've covered a lot of ground today. I think this slide provides a good summary of where Baptist Health started and where it is now. So looking at this sort of before and after view, can you just recap the biggest pain points that originally drove this project and what life looks like in general today on the other side?
Yeah, this really has been a transformational tool for the team. That challenge, right? That low data visibility, a lot of that was driven by that email. Once something said, all right, to resolve this, it's emails and an Excel spreadsheet that's static and updated periodically. That low visibility, right? That's just a huge issue. And then problems being solved in different ways and not a consistent process. So oftentimes it was broken with that data being stale by the time you finished an analysis. And then that idea of just reactive communication instead of proactive. And then the technology you're trying to do in an Excel spreadsheet, it's just not, it's just not efficient. So now, right now, it's really great. Like with that actionable data, right? Everything's about call to action, call to action. And when the system's even automating that, right? It's great. We got that 2.9 million. We know what that was. It was very clear that now it's that efficient process. We know how long we've shrunk that time from 2 months to like a week and a half to resolve. And then the other indirect of just that trust with with our partners internally, with our vendors of, hey, I've got data, I've got the truth. Let's work all off the same source of truth to resolve any issues. It involves a lot more, it creates a lot more trust. And then the workforce, right? We're consistently Baptist Health, South Florida, one of the 100 best workforce. We're consistently on the Fortune 100 list. We take that very seriously. And that's a mandate to all leaders to really create a meaningful and great work environment. And this has just been really great and helpful for us to do that effectively.
Yeah, I think that's awesome. So we have around 5 minutes left. We did get some questions. We don't answer your questions. I don't think we have time to answer all of them, but we will get back to you after the webinar. But starting with somebody who said they liked the Ferrari ERP analogy, spending millions on ERPs, in this case, Workday. But if that ERP still lacks, I guess, the steering wheel in your analogy for communication, for a leadership team that they have to talk to, that feels they already have to that they've already checked the box by buying that ERP Workday. They asked, how do you justify the ROI of adding a communication layer tool like this?
I think it's helping people understand that first slide where it showed kind of that full process. I think it's really helping people understand those sort of gaps between the ERP things, right? And hey, this is how it actually works. And hey, look, this is great. All the things that ERP does is great. It tells you the problem is. CRMs and the health chain solution, they are designed to be communication tools, right? That is what they are built to do. And in order to solve the problems that the ERP tells you, you have to communicate. So it's really the combination and putting that on top of it is you get the more people understand the process, they see it like, oh yeah, that's right. Okay, so I have this list of stuff that now I have to go and draft all these emails to resolve it. So that's usually our approach to look and help and explain it.
Yeah. So I think this question is slightly related to that. It's around burnout. So they said, we know that our process is a problem for match exceptions, but our team is exhausted by new software. What was your strategy for getting the staff to actually embrace moving out of Outlook?
It's a combination of like pushing them into it, but also a little push pull, right? In terms of you got to demonstrate, show people, try to explain and convince people that this will be a better work experience and reduce a lot of the mundane tasks that they got to do. So part of that's just educating and training on what that is. And then part of it is also just mandating, hey, this is what you're required to use this through that. And it's pretty easy to track because then you're going to have a match exception that comes up, that a case that's created, and you're not going to have it's going to appear that it wasn't worked. It's a combination of those two things. Once people got in the swing of it, though, it was pretty clear and embraced, I think, once people started to use it.
Yeah, that's perfect. I think one more. So this is more of a technical question around how I think ERPs work. So you said that ERPs often overwrite data to process payments. Could you explain the mechanics of how that money stays hidden and why an audit after the fact usually fails to find it.
Yeah. So, right, one of the things in health chain is as soon as there's a match exception, there's a case created, and that case has that information pulled from the ERP and the invoice that you have. So, whereas in a regular ERP system where there's an exception, it might be, for example, a list price as an example, right? If you're overcharged, how do you pay that? You might just override the price and the system, the exception and matching in order to push it through. And then there's typically no audit trail for that, right? Or at least not in a way that is easily identifiable, right? So it's this the concept in the health chain tool that is really powerful is as soon as a problem is identified, a case is created automatically by the system. Nobody has to go in and create some form to create a case. It's auto created by the system, right? So that's what drives that visibility, which the ERP just doesn't have that functionality to identify each issue as its own sort of case and unique identifier to then have whatever audit trail is done to resolve it.
Yeah, that's great. So there were a couple questions we didn't get to, but I will follow up with you after the webinar to answer those. The last thing I'd like to just offer to you is that we're really here to help you stop overpaying on your supply chain. A lot of what we talked about today is going to come down to your own numbers, your own processes, but all attendees of this webinar can come and do a free assessment with us where we will go through your numbers, go through your processes, and really take a look at where that hidden leakage might be, calculate the efficiency gap that you might have right now between the ERP and then solving those match exceptions. Will help you benchmark your performance so you can see how your match exception rates compare to industry leaders like Baptist Health. And then also that's going to help us really build an ROI roadmap so you can walk away with a report to track your future savings, the impact of automation that you might put into your process, and then also just general vendor compliance. So if that's something that interests you, just simply scan the QR code or go to penrod.co/supply, and we will set up a 30-minute meeting with you. So Matt, I want to thank you for joining this. I think it was incredibly insightful, and I hope that everybody got a lot out of your advice on how to stop overpaying on the supply chain. So thank you very much for attending this.
Happy to do it, Matt. Great to be here.
Yeah, and everybody who attended, thanks a lot for your time, and I hope you have a great afternoon. Thank you.